I believe strongly that most of us who went to medical school love clinical medicine, but it's all of the administrative burden and everything else that gets in the way of you taking care of your patient that
Mm-hmm.
makes us want to leave medicine.
Yeah.
And I think, you just got to try to cut down those things as much as you can.
Hi, Anne. How are you?
I am doing well. How are you?
I am good. I'm so excited to have you on my podcast. And there is so much to talk about. For our listeners, can you tell us a little bit about yourself and what you
Yeah.
do?
So, yes. My name is Anh Nguyen. I am in my late 30s. I live in Houston, Texas. I am a full-time emergency medicine physician at one of the hospitals here at a very big hospital system. I also am the medical director for our system's telemedicine program, or virtual urgent care, as we call it. I have two daughters. I'm originally from Vietnam, and I've been living in Houston for since 2014, so probably almost 10 years now. So just very happy to be here in great company and with another physician mom.
Yeah. And did you go to medical school in Vietnam or in
No,
US?
I went to medical school in Houston at Baylor College of
Oh,
Medicine,
okay.
and then I did residency in New York City, and then moved back to Houston after that.
Awesome. So, how do you manage all of these things? It seems like a pretty busy schedule. ER physician, director of an urgent care, mom of two.
Yeah, I mean, I don't think I do. I think the balance is survival. I would say. So, definitely there are hard days when I jokingly, message my friends and my husband and say, I'm not thriving right now, I'm surviving. And so, like, really the challenge is going from that surviving to the thriving stage. So, you know, it takes a lot of prioritizing. Be very organized, kind of the basic tips that I think medical students, all moms, all physicians in training, they have these skills, right? They're organized, they understand how to prioritize. What was important for me was kind of accepting that with the prioritization, like some things will fall by the wayside, and that's okay. There's no reason or need to be your number one doctor self, your number one mom self, your number one wife self every single day. And sometimes you just accept that things will fall by and then you just try to pick them up the next day and move on.
I love that you say that. Uh, we don't have to be a number one in everything all the time, every day, every single day. I agree with that. With the me being a career transition coach, I talk to so many physicians who are wanting to leave clinical medicine and looking for non-clinical roles. What do you think about how do you feel in clinical medicine?
Yeah. Honestly, I think you just have to like look in yourself and be like, hey, at the end of the day, my soul, does it tell me I need to be a physician? Do I need to be clinical? Do I need to see patients to feel fulfilled? And if the answer is no, then by all means, absolutely. Like take your science knowledge, take those skills that you've learned, the organization, the balance, and apply it somewhere else and do good elsewhere in the world. I believe strongly that most of us who went to medical school love clinical medicine, but it's all of the administrative burden and everything else that gets in the way of you taking care of your patients that makes
Hmm.
us want to leave medicine.
Yeah,
And I think, you just got to try to cut down those things as much as you can.
yeah, and that's what I hear too. They love seeing patients. They love the medical part, but it's everything else that makes it difficult to stay in clinical medicine. Um, Now, I see that you also are a director of a virtual urgent care center. And can you tell us a little bit about that role and your
Yeah.
duties? Hmm.
Yeah, it's more than just kind of like urgent care director. It's telemedicine. So
Hmm.
I'm super passionate about telemedicine. I've been
Oh,
doing it since before the pandemic,
uh-huh.
before it was cool.
Yeah.
So it's just a great way for convenience, obviously, for the physician and the patients.
Mm-hmm.
I really want us to start expanding to remote patient monitoring. So I think like, okay, what is it that I do when I see my patients? The ones who are not emergently crashing, of course, who don't need a hospitalization. Like,
Yeah.
what do I do for those patients in person? I do physical examination. I take their vitals. I treat them with medications or a procedure as best as I can.
Mm-hmm.
So I obviously can't do the procedure virtually, but what I can do, like I can have the patient palpate their own abdomen. I can look at their throat virtually. I can look at their rashes virtually. Remote patient monitoring is giving us ability to check the patient's vitals remotely and kind of monitor it over time. So my real passion is kind of that spectrum of what do I really need to be in person to do? What can I,
Yeah.
teach the patient to do or
Yeah.
have a machine do?
Yeah. Awesome. That is so cool. So with telemedicine, do you think there are some challenges as well as an ER physician? Um, is there a higher risk of liability in telemedicine versus ER?
I think it just depends on the way you want to practice because the patient and the provider enter into the relationship knowing it's not in person. And
Mm-hmm.
so the threshold for sending patient for in-person care is very low.
Yeah.
So if anything, we over refer. Like I'm like, this patient is probably okay, but they have
Yeah.
this one concerning symptom. So I'm going to
Uh-huh.
refer them for in-person
Yeah.
care. I mean, honestly, that's the biggest,
Mm-hmm.
you
Yeah.
know, swing for me. I think we swing way too conservative, and that's okay. It should be that way for now, at least.
Okay. So what would you say to a medical student who is considering a residency in emergency medicine, looking back at your, all the wisdom you've gained?
Yeah, emergency medicine is tough. Um, I think the most important thing that I would say, and it's actually not clinical, is that the person who wants to do emergency medicine should remember that they're not going to always feel like they're 20 or 25 or 30
Yeah.
because your body does not respond to night shifts and shift work and swinging hours the same at 25 or
Mm-hmm.
at 30 or at 35 or at 40. You won't feel the same. So you may feel totally fine after a night shift now. And I did for many, many, many years. And obviously now it takes me like days to recover from one.
Mm.
So the physiologic strain is going to be there more so, I feel like, than other specialties.
Thank you for that. And is there anything else you would like to share with my audience?
I think, one of the most common questions I get asked is, motherhood and doctoring and
Yeah.
the balance. And the first question you asked me really.
Mm-hmm.
Um, and like my number one advice to them is delegate what you can. Like, so first of all, prioritize like what's important, right? Like I have to see patients. I have to show up to work. I have to write my charts. I have to get it done. Like that's all me. But even in the ER, I have to delegate some tasks, right? Like the nurse can help set up the laceration tray and clean the wound and prepare everything for me.
Mm-hmm.
So it's the same at home. Like if it's not something that's going to contribute to you spending quality time with your kids or quality time with your spouse or improving yourself in some way or even just relaxing. If you can help, if you have someone or the ability or the means to delegate that, like you must. Otherwise, you will go crazy and you will burn out.
Yeah.
And
Outsource as much as you can.
yes, yes,
You don't have to do everything. So yeah, that is really
no. And then just
important.
also accept not perfection. I don't do the dishes. Like some nights
Yeah.
I leave them for the morning and I'm okay with that.
Yep. Speaking of dishes.
Yeah. Yeah. I don't put away the
uh
toys. I step on
yep.
a fair amount of Legos.
Yeah. Yeah. All right. Well, it was very nice talking to you, and thank you so much for sharing your advice. And I look forward to speaking with you again on some other episode.
Yeah, perfect. Thank you.
Thank you. Thank you.